Hello, I'm Steve Lacey and I'm the Director of Education for ASMERT. I'd say almost all of us who work in a clinical environment would have at some point come across a patient who is autistic, but have you thought about what the hospital experience would be like from their perspective? Now, I'm sure you'll all agree that the following happens in a hospital. There's the bright fluorescent lights. There's lots of people talking. Think about all of those alarms going off. So the machines are beeping away, the trolley's being wheeled around, there's sounds of other patients in distress. And then there's those smells as well. So think about smelling cleaning products, plastic, chemicals, all of these things that we actually take for granted. And then there's the interactions with the hospital staff, the people that the patient are unfamiliar with. These people are asking questions that can be hard to answer, like explaining pain and symptoms and other feelings. And then the clinician has to examine them, which requires physical touch and invasion of personal space. And sometimes it might also require the attachment of equipment. So this all sounds very incredibly overwhelming, especially for people who are autistic. So what can we do to make this experience a little less overwhelming? Well, let's hear it from someone who is openly autistic, and that's Ben Potts. Ben is a radiographer in the UK and has a passion for improving the experiences of patients with autism. He's currently doing a PhD through City St George's University of London on the NEEDS project, which is focusing on improving emergency department care for autistic, ADHD, and AUDHD adults. Welcome to Radpod, Ben.
Hello, it's a pleasure to be here. Yeah, I think that you've given a really good example of what it's like. I think as well, there's the lack of logic. I think a lot of autistic people find that they need to have all the information of a situation or scenario or a place to understand really what's going on and how it fits. So they can predict what's coming next and what's going to happen.
Yeah.
And there's just a lack of information often with medical appointment, not communicate very well what's going to happen and what's coming up. But particularly in the medical radiation space, we have cold rooms, which can be, a sensory thing. There's lots of enclosed spaces.
Yeah.
If it's an MRI, CT or radiation therapy.
Yeah.
And then we also have the positioning as well, standing in awkward positions that may feel uncomfortable. So we just have that extra layer for the other things we ask patients to do that can just be more challenging.
Yeah, fair enough. And so what impact does this actually have on the patient? Like how will they generally react?
So often it can be just very, very stressful, sensory overwhelm. And if that gets to a crisis point, it can be either a meltdown, which you can see as like an outward display of the inward stress going on.
Yeah.
Famously, people might see that in supermarkets. Often children react this way.
Yeah.
We have found people that adults or people that are particularly more reserved often have an inward meltdown, which is called a shutdown.
Yeah.
And that then is very hard to see outwardly. You won't see anything. Maybe they'll stop responding. Maybe they'll one-word answers, and just be no reaction to the outside world. You see no emotions, nothing.
Yeah, right.
So people assume that can be then that they're calm and relaxed because they're not. There's no reaction at all. It's actually the inwards they're in a crisis point.
Yeah, right. Okay. Now, I do remember at a recent education event that ASMERT ran in Victoria, we had a presentation from the parent of a patient with autism, and she said that her son would just go quiet, which is something that you've obviously said. And I think that gave the staff the impression that he was okay rather than he was kind of inwardly reacting to that itself. Do you find that staff treat patients differently once they know that they're autistic?
Yeah. And I think it can go a couple of different ways. Sometimes people they're almost too gentle or too thingy where people like children, and if they're adult, they kind of like infantilizing them.
Yeah.
And I've heard a couple of experiences from work I've done where I've had conversations with patients about their experiences. One was a mother she was autistic, took her autistic children to an appointment for them. And then when she told them that she was autistic and so her children, there was kind of almost questions about how she is a mother. Is she a mother? How her mothering is going rather than what the children, their experiences.
Yeah.
So it's like the competency thing of like, can you be a mother and autistic?
Yeah, right.
So, that then made her almost want to leave the whole thing and forget about it, not completely lack of trust.
Yeah,
It just really damages that whole relationship, the whole of healthcare, that one experience. So,
yeah. And I think that was kind of what I was going to get to next, which was about that lack of trust and that. And so what other impact do you think that this might have on the hospital environment and on the way that the autistic patients are actually perceiving the hospital system?
Yeah, we know from the research as well, one experience can mean that someone will never go to hospital appointment again.
Yeah.
So if someone's gone for a screening test or something, very simple, quick in and out outpatient thing, then that have a horrible experience. And then later when they actually need something for like a chronic illness or something really acute, something very, with a high severity, high acuity, they won't go for that appointment. And, that then results in some really shocking and upsetting outcomes, low life expectancy, and lots of chronic illness that can probably be better managed that's not managed. So people live in pain when they don't need to be, or struggling when they don't need to be.
Yeah, absolutely. So for someone who is openly autistic, and you've been very open about that yourself, how has this changed the way that you interact with patients?
I think that I'm much more empathetic to the whole experience, knowing it from both sides of the table, so to speak. So, I can understand the sensory experience because I'm in there all the time. But also it's helped with disclosure, me being open about it. I wear a badge that says autistic, a different way of looking at the world.
Yeah.
So if patients can see that, then they're more likely then to be open and say, "Oh, I'm autistic." And then, once we have a conversation, that's on the table, and we're open about it. They're then much more likely to open up about what they need, how it can make things better for them, and then we're more likely to have that relationship. It's quite quick.
Yeah, that's a really interesting point. I don't think in all of my years working as a radiographer, I don't think I've ever had a patient come to me and say that they are openly autistic. I have had patients sometimes that will be flagged that they're autistic beforehand, before they actually come into the room, and people will tell us. Sometimes they're not flagged at the same time either. Sometimes we don't know. We just wait. They come into the room and it's quite obvious, I think, then that they're autistic. So I'm sure that for you to disclose this to your patients would actually be quite huge, because it actually provides something that's relatable to them. But I'm also sure that if we knew that patients were autistic or had ADHD prior to them coming into the room, it would give us the opportunity to make that experience better and more comfortable for them. How do we give the patient space to openly disclose their autism or their ADHD?
I think it has to start right from the appointment letter. So it could be something where as simple as, if you have any needs you want to discuss or anything where we can make the appointment better for you, just an open question like that. So it's straight away not seen as something where they have to ask for an extra thing. It's like part of the service that everyone gets.
Yeah.
So they don't feel like an inconvenience or it's a trouble, so that conversation is there. You're making it safe to discuss it straight away.
Yeah.
I think that can also go for like hospital passport. Often they're called hospital passports, but they can be called like a patient care guide or something like that, where people can write, and it can be done pre thing that they do at home, and it could be for all medical appointments. So staff can have this list of things that they know, or things that they don't like, or things that they can't manage, how they can make things better, how they can improve things. And it's just having that dialogue right from the start, where they know that it's going to be a safe thing to discuss.
Yeah.
I think because often the alerts on systems can be more for the staff benefit than for the patient. In that if it's a patient that's caused a lot of issues for the staff, so they've had to cancel out appointments because they've had to use that whole appointment block for a patient they wasn't expecting. It's like almost one staff that this is someone you need to be conscious of, rather than what does the patient need, how can we benefit them.
Yeah.
So I think sometimes the flags are not put on there for the best reason.
Yeah, yeah. Look, I think these are some really, really great ideas. And how can we then change the way that we work in order to be able to recognise these types of flags?
So I think it just has to be something that comes from the patient. So it has to be what the patient needs, what they want, and it's something that they're happy to be disclosed.
Yeah.
But once we have that information, we can then start preparing the room earlier and putting those things into action. So before the patient comes, rather than waiting for them to come, have an awful experience, and then putting things in place for the next time they come, because there might not be a next time they come.
Yeah, right.
So preparation is the key.
Absolutely. Now, you're relatively new to the career, like a still fairly early career radiographer. One thing I didn't touch on in the introduction was about the student who is autistic. So I would like to discuss this a little bit. What were your experiences like as a student with autism?
So my personal experiences were not too bad, but I think I was one of the lucky ones, to be honest. I just had a really nice team around me, but I know many students did not have the same situation. I was just very aware when I was on placement that the same sort of care and appreciation of adjustments, what we needed, was very apparent in university, but not on the actual clinical space.
Yeah.
I think a lot of radiographers didn't think of it as a learning space. Think of it as it's a clinical space, and that's its priority. But also for a lot of people there, if you're in a teaching hospital, for example, it's also a learning space.
Yeah.
So at university, I would have extra time for exams and stuff. I'd have like a clinical help with like academic work. Then placement team was kind of off you go, and then everyone's just the same. There's no kind of tailored to anyone's particular needs.
Yeah, right.
And I just became very aware of that and discussing that with lots of colleagues, other students that were from like nursing and other parts of the allied health professions. Came apparent that it wasn't just it's not radiography. I think it was all of healthcare education. And once we discussed it more together, and we kind of raised more awareness of this problem, everyone started to go, "Oh yeah, we never thought about that," and suddenly it started to get better. And I think over time now it's starting to improve a lot.
Yeah, okay. So if you were supervising a student or you were the main contact point for a clinical placement for a student with autism, what do you think would help them?
I think aiding them to disclose would be a big factor.
Yeah.
And I think that needs to be something that's discussed straight away, really early on. I think being that point of contact where they can come and discuss things like that, and that being like a normal thing that we discuss. It's not like similar to patients, really. It's not like an extra thing where they feel an inconvenience or it's an extra trouble. We do, all students we have this discussion. How can we make things a better learning experience for you?
Yeah.
What do you need? And that should be for all students. So then, the autistic student feels like they're not, I'm doing okay for an autistic student. It's not that. It's like you're one of the students and, we try to get everyone the best experience. So how can we make sure that you learn best you can?
Well, and you're right, because every single student comes to clinical placement with different learning needs, whether that's someone with autism or not. It doesn't really matter because they always have something different. So it would still be helpful, though, surely, for them to disclose that, because then that would obviously be helpful to talk about them, what their learning goals are and how they might be able to learn. How do we give someone the space, the safe space, I guess, and the confidence to be able to disclose their autism to their clinical placement?
I think having that first contact with the student or the student group and then raising it there, is there anything you need to discuss, and putting it on the table straight away. So, that friendly first email of people, you get a group of students come into your placement site. In that email, that very first message can be, I'm going to be the practice educator.
Yeah.
I'm looking after you for this placement block.
Yeah.
I want to, let's have a conversation about it. Let's come and see me on the first day, meet me here.
Yeah.
And, give clear information about where to go, who you're going to see. And then you can open that conversation straight away and have that dialogue. And I think that just get it out in the open, make it safe, make it normal.
Yeah.
Yeah.
Absolutely. So once they have disclosed it, then what next? Like how would a clinical educator then tailor the placement to the educational needs of the student?
Usually something. So personally, I had a meeting with practice educator and someone from the university, and it came with, I already had an academic support plan. So then we was on placement and we were support with a university representative and practice educator. And we went through my academic support plan and looked at how we could alter that for a placement support plan. So I had a particular plan just for placement based on what I had for an academic one.
Yeah.
So I think all students could really benefit from having a plan in place that lists the adjustments they need. And then it gives them that, once it's in writing and it's secure, it's like solid thing. It's like, oh, I've got this in place. It gives you a peace of mind knowing that you have those there, you need them. And you might not always need them because, your needs change throughout placement as well.
Absolutely.
When you get more familiar and, maybe you get more confident and the anxiety drifts away a bit, you might not need certain things, or certain things you might need more later in the placement period. So, but having them there, it's just a peace of mind of knowing you've got support when you need it.
Absolutely. Yeah. And that's really important, I think, anyway. Let's move on now to your PhD and the Needs Project. Can you just explain a little bit about what the Needs Project is?
Yeah, so it's neurodivergent patient experiences of emergency departments.
Yeah.
That's the acronym. And it's for autistic, ADHD and ADHD patients. And I'm looking right at the whole emergency department experience. So when someone first realises they need emergency care and they go, do they go for an ambulance? Is it somebody they go themselves? And all the different parts of the emergency department they might go to. They might go to a waiting room and then a major department or minor department, or maybe into resource, depends on the severity of their problem. And all the way through, all different people they see, different professions.
Yeah.
And right until they either discharge or maybe discharge themselves, depending on how it goes.
Yeah.
That whole experience, I'm looking at the whole.
I really like that, particularly the first part. How do they actually choose to engage with the healthcare system? Do they do it via ambulance? Do they do it themselves? Does somebody take them? How does that actually all work in that? And I think that's a really good place to start, I think, with that anyway. But let's think about some of the stats. So the stats that we've got here is that a third of autistic adults avoid medical care, and 40% of autistic adults wait more than 2 years for access to mental health services. Is that statistic a result of the autistic patient, or is it a result of the system itself just not being capable of being able to take them so soon?
I think it's probably a mix of both.
Yeah.
Yeah, I think it's a mix of both. I think there's such a long waiting list for everything related to neurodivergence. For diagnosis, for support that's tailored to neurodivergence, such a long waiting list. But I think as well, it's the bad previous experiences that have such a detrimental effect on people.
Yeah.
That it stops people going in the future.
Yeah.
People often have almost like post-traumatic stress from medical appointment. Sometimes I wonder if we're imaging, doing trauma imaging, or we causing the trauma from the imaging.
Yeah.
Which where does it come from? So
I get.
I think it's probably a mix of both that leads to these statistics.
Yeah. What gave you the idea to do the needs project itself?
So I came from it from wanting to do. I work in a major trauma centre.
Yeah.
And really interested in trauma imaging. That's something I really enjoy, giving care when someone's in that really high pressure situation and they're going through, some really, really horrible times, and trying to give care while you're trying to also position and do problem solving of all the trauma imaging. So you're trying to do both of the things at the same time. I really enjoy that. When I was coming to start the project and look at, how do I look at trauma imaging, I realised there was actually no research of the whole emergency department experience.
Yeah.
So I couldn't look at that in isolation because we don't work in a siloed kind of area. People don't go straight to trauma imaging. There's always different parts of the experience they go to. And they might already be overwhelmed by the time they come to see us anyway. We can't ignore all that experience. So there's no research, and it's all a big round experience. I need to look at the whole thing.
Yeah.
And that's where I had to just, as a radiographer looking at emergency care, it's quite different, looking at all the different professions rather than just our own. Yeah, I think it's just so needed. This research is just so lacking, so someone needs to do it.
Yeah, absolutely. And you're the man for the job by the sounds of it. So what do you want to get out of your PhD? What do you hope to achieve?
I just really, really want to make a difference in this patient group. Being part of the group myself as well, but also, understanding the difficulties people have. It was early on when I first started coming up with the idea of the PhD. I wanted to look at the experiences, and that was kind of where my plan was. Then working with autistic ADHD people to come up with be guided by them. It was their idea that there was a real urgency there, not just understanding experiences, but what can we do? What actions should we take?
Yeah.
With my clinical hat on, I was thinking, well, we can't come up with loads of ideas that aren't really practical. So we need to come up with something that NHS in its current situation, with the cuts and the current climate, is also likely to be something they can put in action, something practical, that realistic. So that's my goal, is to come up with something that we can actually do that's going to change and actually save some lives.
Yeah, great. Look, Ben, it's been an absolute pleasure talking with you today, and thanks for joining us on Radpod, and welcome to Australia as well. I hope you've really enjoyed your time here. What key messages do you have that you can pass on to our listeners out there relating to both patients and students with autism?
I think you need to stress that their needs are legitimate. And needing adjustments is not like an extra thing, not inconvenience. It's part of all care, all education.
Yeah.
Everyone should have an equitable chance, equitable opportunity. So I think if you can communicate clearly, use more direct physical languages.
Yeah.
Try and give as much information as possible as well. Having that understanding of the whole system, of how things work, really, really helps a lot of autistic people.
Yeah.
I think also not assuming that a calm patient, or what looks calm, someone that's happy, or it looks that it can be deceiving, and you just need to be constantly checking in with patients to understand what's going on.
Yeah.
And I think as radiographers as well, if we can try and train our autopilot a bit, so we have this version of care in our head that we give, which is often different to what happens when we're tired and overworked and stressed. So if you can put in little things in everything you do, so you might just give extra time for people to process new information, or you might check in a few extra times than you would normally. You try to add these things in, so where you are stressed and tired, you do those things anyway as your autopilot. I think that would really help. But also, I think generally, if you can try and become an advocate for this patient group, and if there's any training or anything that you think you could benefit from, and if you make sure all the rest of your colleagues and staff are also trained in that way, and try and fight for this patient group, I think it will really help if we all, because we really need more people to advocate for this.
Yeah, absolutely. Ben, look, thanks again for joining us in that. It's been wonderful talking to you.
Thank you very much. I'm pleased and honoured to be here.
Great.